3-stage, 5-stage, 7-stage model of dementia. It can be so confusing, all these different models. What is the deal with all of these different models? Hello, my fabulous fans. I'm so excited to talk to you about the stages of dementia. Welcome to Answers About Alzheimer's. I am your founder and host, Debra. We're posting new content every Tuesday and Friday at 1 p.m. Eastern Time. Today, we're going to talk specifically about the 3-stage model. Most physicians will either use the 3 or the 7-stage model. The more common is the GDS, or Global Deterioration Scale, and that is the 7-stage model. The GDS model, or Global Deterioration Scale, is based more on cognitive testing. I do have a video that talks about the 7-stage model. It's my most popular video, so make sure that you watch that one. It's really, really good. There is also the FAST, or Functional Assessment Staging Test, that also has 7 stages. This test has the ability to assess the level of functioning for the person with dementia and their ability to perform tasks and activities of daily living, or ADLs. So someone could be in stage 1 for the GDS model and another stage for the FAST model. There are several different models for diagnosing the progression of Alzheimer's and other dementias. But for today, we're going to talk about the 3-stage model of dementia. There are over 100 different types of dementia, and there are several diagnostic tools that physicians can use. It's just the personal preference of the doctor. It would be a good idea to find out from the doctor that you're working with which model she or he will be using. When the 3 stages of Alzheimer's are referred to, the stages are called 1, early or mild, 2, middle or moderate, and 3, late or severe. For the purpose of today's video, we will refer to these 3 stages as early, middle, and late. It's very important to note that when a person moves into the next stage, they may not actually probably not, have all of the symptoms of that stage. Alzheimer's and other dementias are a progressive, degenerative disease, and it's not so clear-cut. Every person diagnosed will move through the progression differently. The patient will also fluctuate between the stages and show symptoms from more than one at a time. This fluctuation, of course, can make navigating tougher on families and medical personnel. It can be particularly frustrating for caregivers to experience the fluidness of symptoms. In some cases, we may even feel that our loved one was misdiagnosed because they're having a really good day, or we might get agitated and feel that they are being lazy because a task they could do an hour ago or yesterday cannot be completed today. The stages presented today are only a guide and should not be used for personal diagnosis. That should be left to the neurologist or the gerontologist. If you are at the beginning of your Alzheimer's or dementia journey, or you think that a loved one may have a neurological or cognitive problem, please go get a diagnosis. If you're seeing signs, then it's time to talk to someone who specializes in dementia. Typically, a diagnosis will take several visits spread over time. So getting the process started and getting a baseline analysis is very important. And please don't wait to get started with your doctor. This can be a scary time, but don't let fear prevent you from making an appointment. It may take several months to get into a good neurologist's office. And remember, some dementias are reversible. So please, I beg you, make the call. Personally, I think that neurological exams should be more routine as we age, like physicals or mammograms and dental appointments. Before the 3 stages, another cognitive disorder may be recognized, and that is mild cognitive impairment, or MCI. MCI is a middle ground, if you will, between age-associated memory impairment, AAMI, and another dementia such as Alzheimer's. Although not everyone with MCI will develop another dementia like Alzheimer's. When a person has MCI, or mild cognitive impairment, they may have some bothersome type memory lapses that they would probably brush off as normal aging. It is something that we would notice, but we would not have symptoms severe enough to impact our daily routines. Approximately 10 to 15% of people with MCI will go on to develop dementia. There are 2 different types of MCI, amnestic MCI and non-amnestic MCI. Amnestic mild cognitive impairment involves memory, recalling recent events, and recalling conversations. Non-amnestic MCI involves our critical thinking other than relying on memory, such as poor judgment, time and date, sequencing, completing tasks, and visual spatial relationships. I'll get into both of those in another segment. Let's dive into the early or mild stage, stage 1. The early stage will typically last an average, because remember, everyone is different. So on average, the early stage will last approximately 2 to 4 years. Alzheimer's in particular can last anywhere from 2 to 20 years. My mom was on the 20-year journey when she was killed, but that's another video. You can look that one up. I completely spill my guts. It's unbelievable. You just can't make this stuff up. Anyway, if you're caring for someone with Alzheimer's that could potentially last for 20 years, that's going to need some planning, wouldn't you say? So let's take the early stage. And again, people can and will fluctuate back and forth in these stages. They will overlap with the symptoms. With the earlier mild stage, the person with dementia will still be independent. They may notice that they don't recall things that they just read, or they may have difficulty recalling newly learned information or conversations. For instance, the person may not remember that they just talked with a friend on the phone about going out to dinner, or they may accuse their daughter that she never told her to write down that doctor's appointment in the calendar. During the early stage, a person with dementia may show signs of a shorter attention span. They may find it difficult to follow a conversation. If they're still working during this stage, they can still drive a car, and coworkers might start noticing a change in their abilities or lack of concentration and multitasking. Coworkers and family will begin to recognize cognitive changes. As the disease progresses, the person with Alzheimer's or another dementia in the early stage may start having issues with paying the bills and keeping track of the date, day, and time. Problems with the calendar and organization may arise. Struggles with organization can affect their work environment. When a patient is in the beginning stages, they will start to have difficulty with their executive functioning. This means problems with planning and following a particular order of things, like following a recipe, steps in a game, following instructions, or planning a trip. A person in the early stage may not use their best judgment when it comes to their health and money. I can just see you nodding out there. A common symptom of this stage is to misplace items and be unable to retrace their steps. That is also executive functioning. They may forget the words of familiar objects or people's names. So during the early stages, you can see that while annoying, the person is still able to carry on day-to-day activities without any assistance and live normally and independently. This is the best time to begin seeing a specialist and develop a relationship with a trusted healthcare provider. This is also the best time to get the family educated about what is coming, how to handle it, and to discuss final arrangements and wishes of the person with dementia so that they can be included in these choices and conversations. As we move into the middle or moderate stage, things progress and situations can get more tedious. The middle stage is typically the longest and the most difficult. This stage can last anywhere from 2 to 10 years. It gets taxing for family members when the person with dementia has disrupted sleep patterns. They may have outbursts of anger or violence. When people with dementia advance in the brain damage, they may become fearful and refuse to bathe. I have a whole entire video on bathing. It's really awesome. And you will be surprised about how some of the information in the bathing video. So make sure you watch that. In the middle or moderate stage is when safety becomes an increasing concern. Driving may no longer be safe, and the risk of starting a fire is a huge concern. People with dementia often start fires. Wandering is quite common in the middle stages of neurodegeneration. As the disease progresses, the person will tend to self-isolate. They cannot initiate a task and become bored, lonely, and scared. They feel disconnected, and they long to feel safe again. This patient will no longer be able to read, write, or follow conversations. Language and communication skills need to be adapted for both the person with dementia and the caretaker. The diminishing abilities make it difficult for the person to express their needs, wishes, and desires. It's very, very disheartening. They will need assistance with personal hygiene and dressing. Accepting help on such a personal level can ignite behaviors, anger, depression, and can begin to strain the relationships. This stage is where people need to apply all their knowledge and education that they can get their hands on. Those in this stage, if English is their second language, they will eventually no longer understand English and revert back to their native language. The middle stage is the toughest and the longest. Often, this is when families decide that a move to a care facility may be their only option. The last stage of the three-stage model of Alzheimer's is the late or severe stage. This last stage will usually last an average of 1 to 3 years. During the last stage of dementia, the person will no longer be able to communicate or have very limited vocabulary of maybe a phrase or possibly one word. They will be completely dependent on others for all of their needs and survival. At the end of the disease progression, they will be bedridden and require 24-hour care. Eventually, the person will not be able to swallow, and finally, the brain stops sending signals to the heart and the lungs, resulting in death. During this stage, it is important to maintain dignity for the person with dementia. They will respond to kind voices, a loving touch, music, and compassion. Even if you feel that they are unresponsive, give them a feeling of warmth, comfort, and safety. It will be the greatest gift you could ever give. I'm Debra, founder of Answers About Alzheimer's. I love what I do. I love helping you. So shoot me a comment and let me know what your struggles are, and I'll make a video just for you. Hit that subscribe button. It's free. See you next time. Hi, I'm Debra from Answers About Alzheimer's. If you're new and just joining me, and maybe you've only watched a few videos, I really wish that you would comment and let me know what your struggles are, because the whole reason I do this is because I want to help other people. So the more you tell me what you're looking for, then I feel like the more I can help you. So shoot me a comment and then we can work on all your problems together. Physicals or mammograms and dental appointments. Did you just see that fall over? Let me just fix that. Okay, so